Om Shri Sai Ram. At the outset, I would like to thank Bhagawan, Shri Sathya Sai Baba. As I look down the memory lane and think about the last 30 years that have gone by, it's so difficult to think that 30 years have gone by because I just feel like as if I've come yesterday, which is of course not the case. Because when I came, I was an absolute novice. I was a freshly qualified cardiac surgeon who hardly knew anything, who had barely done few surgeries. And today, where I am, a fully qualified, able to do all the cardiac surgeries, I feel it has been a long journey. And definitely, what I am today, I wish to say that I am what I am today because of Bhagawan. I was associated with the organization right from a very tender young age of 10 years of my life. When we shifted to a new residence in Bombay, there were Bal Vikas classes going on there. So I was attracted to those classes, and that's how I came first in touch with Bhagawan. I joined the pre-Sevatil and then became the Bal Vikas Guru, and then went on to become the Bal Vikas convener. And then came my studies where I joined the medical field. And that's when I still distinctly remember I was in Dharmakshetra. Bhagawan had come to Dharmakshetra. And I was talking to Kamla Pandya Didi that, Didi, I have to leave this organization because I have to pursue my higher studies. It's not becoming possible for me to continue my studies and continue doing the organization work. I don't know whether I will ever come back. And I remember Didi assuring me, you will definitely come back without fail. And I had handed over my resignation letter, and then I went to the medical field. So I went on to become an MBBS doctor. After that, I joined general surgery. But I had more higher dreams. I wanted to be not just a general surgeon, I wanted to be a cardiac surgeon. Though in the early stages, I was always scared that whether physically it was possible to cope up with this field at all or not. But I think this is where exactly I feel the hand of Bhagawan is seen, and the underlying role as we'll see now. What happened was I finished my general surgery, and for super specialization, I loved to do baby surgery. So I gave my first choice as pediatric surgery and my second choice as cardiac surgery. Now it so happened, we appeared for a super speciality exam interview. It was an all Maharashtra exam. I had stood the 33rd rank. The 31 people before me, they got their call letters and they went on and joined. But the 32nd fellow, he had some objection and he went to court, and there was a stay order. So I could not join, and there was a delay by at least 9 months. Now this is the time, I think it was a godsend opportunity for me, where I decided in my own hospital, there was cardiac surgery program going on. And I decided that I should go and see whether how difficult it is or how is the cardiac surgery. Till then, I had never gone even once to see it. So this is how, when I went to see it, I realized that it was not so impossible a field to enter into. And now I was regretting my decision because my first choice was pediatric surgery. So now things went by. In the meantime, I had applied for a lecturer's post. I had applied for FRCS. So I had too many options. And then came the super speciality interview after 9 months, where I still distinctly remember I had gone to KM Hospital. I was seated in front of the dean's office where the interviews were being held. And there was a big poster there sitting there. I was in a big dilemma because whether I should go for lecturer's post or I should take up FRCS or whether I should take up super speciality, cardiac, not that time it was not cardiac surgery, pediatric surgery, because now my mind was more for cardiac surgery. And I suddenly read the poster which said, whenever there is turbulence, there is progress. So you'll not believe, when I entered the dean's office, as soon as I entered, the people seated there, they told me, Doctor, the first choice of yours is already filled up. Are you interested in your second choice? So you can imagine my surprise and my happiness to willingly agree for my second choice, which was cardiac surgery. And that's how I entered into cardiac surgery field. In my first year, I had come to Puttaparthi. It was the 65th birthday of Bhagawan. And that's the time Bhagawan had made the announcement that he would be starting a super specialty hospital worth 100 crores of rupees. And he would be starting cardiac surgery, he would be starting cardiology, urology, cancer, pulmonary medicine, and brain surgery. So I was absolutely overjoyed. But I do remember as I was returning back, I was, I still feel it was as if I was crossing the hospital site only, looking into the dark space and the stars and whether I will ever come to this hospital. This was the thought which crossed by my mind as I was returning back to Bombay after Bhagwan's 65th birthday celebrations. And I returned back, and it was the second year. It was the October 1991. And I had gone along with my immediate boss to Delhi for a chest and cardiac radiology NICER conference. It was organized by NICER Group. And after that, we went to All India Institute of Medical Sciences to meet Dr. Professor Venugopal. He is the cardiac surgeon, a very renowned cardiac surgeon, and who has done the first heart transplant in India. And also, he is the one who has started the cardiac surgery department in Puttaparthi also, and Whitefield. And we went to meet him in the ICU. And in the ICU, we were talking, and he just noticed this ring, Shirdi Baba ring, which I always have the habit of wearing. So he looked at it and said, "Oh, you're Sai Baba devotee." So my boss knew that I believed in Satya Sai Baba also. So he said, no, she's Satya Sai Baba devotee also. So then he looked at me and he said, "What? You don't you know this hospital is coming up? Are you coming or not?" So I said, "Yes, sir, I know about this hospital." So he's saying, "Come then. You come for the inauguration. It's there in November. You come, and we will be coming from Delhi. You come from Bombay. We'll pick you up at Bangalore, and we shall proceed for inauguration." Now, as luck would have it, I think the time had not come yet. Just 4 or 5 days ahead of that, all the flights had started getting diverted to Madras. There was a heavy storm in Bombay. And so I still remember reaching the airport and ringing Dr. Venugopal and telling him, "Sir, I'll come some other time. I'm not coming for the inauguration." In April 1992, as I finished my cardiac surgery, I rang up sir and I came and spent 13 days in the hospital. And it was like a day and night work. The team would come and it would work for they would be doing minimum 4 to 5 cases a day, and they would be working day and night. And on my return, after 13 days, I hardly had seen the daylight. I had decided that I wouldn't be joining this hospital. It was not the work, I think, which troubled me. I don't know what was it. But it was my mother who said, "You have to still apply for the hospital, and you give your application and we'll go from there." So this happened in the month of April. Somewhere in the month of December, I get a phone call from Mr. Rajiv Mahajan saying that I've got an interview and I have to come for interview for the post of junior consultant in cardiac surgery. So that time, again, there were riots in Bombay, and my dad was not willing to send me alone. And so Mr. Mahajan said, "You bring your dad also." So I said, "Now there are riots, 5 days. Since 5 days, no flights have taken off. How do I come?" So he said, "No, tomorrow when flight is going to take off, you get your tickets booked in that, and you see to it that you come for the interview." So I said, "Okay." So that's how we go to airport again next day morning, 6 o'clock. And that time, again, the officer there says, "Madam, we have to accommodate the previous 5 days passengers. So you come at 8 o'clock and ask us again." So 8 o'clock when I go in the morning, the officer says, I explained to him that I have an interview and I need to go to a rural place in India and all that. So he says, "Okay, I okay your departure." So then we reached Bangalore, and there were one cardiologist and one anesthetist who joined us. And then we proceeded. And Mr. Mahajan said, "Tomorrow we'll all go for darshan. And when I wave out from the veranda, you shall proceed towards the veranda." Now, even though I had been coming to Puttaparthi 2-3 times in the past, I've been so naive, I think, that I used to never enter the hall, which is the Kulwant hall present, I used to have Bhagwan's darshan from outside. Whenever Swami would go somewhere out, I would run after his car. Or when Swami would give discourse in the Purnachandra, I would be seated outside and listening to his discourse. So I never really knew what this meant. But however, I went for the darshan. And then next day morning, it was 7. Before 7, I think Swami had come. And I saw suddenly Mr. Mahajan waving out. And we reached the veranda. And as soon as the door opened, there was Bhagwan Shri Sathya Sai Baba seated. So it was an interview with Bhagwan. I was all the time thinking it would be an interview with director of the institute for my thing. So it was interview with Bhagwan. We went inside, 3 doctors, all of us. And Bhagwan looked at me. He materialized a watch and he fixed the time and it was 7. He said, perfect time, he said. And then he gave me the watch. And then he asked me, I was a Balvika's guru already. So he asked me, did I understand what the watch stood for? So very proudly, I told Swami what watch stood for. After that, Bhagwan revealed few things. And in the very first interview, he told me that I'm coming here. My parents are coming here and my entire family is going to come here. So I was thinking that my parents will come here fine. They may come to settle me here and then maybe go back. But my brother's family coming here is impossible, I thought. Because my brother is very well settled in Bombay. He was doing his business in computers. And he had 2 small children. So I was very skeptical about that. And he asked me to join. So, this was my 3rd year of cardiac surgery going on. I had finished my cardiac surgery. But I had promised my boss that I will not leave him in the 3rd year. So when Bhagwan asked me to join, I said, Swami, I can only join earliest is February. I can't join before that. So he said, no problem. So that's how I ended up coming in the 1st of February, 1993. And I really feel so privileged and proud to have joined this place that I have no words to express my gratitude to Bhagwan. After coming to Parthi also, Bhagwan was very kind. He never imposed upon me anything in a sense. Like I still remember, like Bhagwan coming after 6-7 months, he called me again and he said, he very lovingly said, do you want to work here? Do you want to stay here? Are you happy here? And when I said yes, that is how he kind of again materialized one chain and he put it around my neck and he was very happy. And what happened was within 3 months of my joining, the only cardiac surgeon from All India Institute left. Now you have to understand my position. I am the only cardiac surgeon who has hardly done any surgeries. I have done some closed heart surgeries. I have done very few open heart surgeries. So I wanted to make it very clear to Bhagwan that I cannot do open heart surgery. So I come to Darshan line ready to tell him all these things. And there comes Bhagwan. My mother had said, you carry some akshat with you, rice, to get blessings of Bhagwan before you start anything. So there comes Bhagwan from far. He spots me and he immediately puts the akshat on me and he says, start doing closed heart surgeries. These are his words, start doing closed heart surgeries. So, that's how I begin my journey here. I start doing closed heart surgeries 3 to 4 per day. Now, this was somewhere around the month of May. And then by August, I had become quite confident that I can start doing simple open heart surgeries. So that was the time when Bhagwan had gone to Bangalore, Atrai Vrindavan. So I go there. I still distinctly remember the date. It was 15th of August. And I again go to seek his permission to start doing open heart surgeries. So again, he spots me from far. And those were those lovely days where he would shower chocolates and whatnot on all of us. So he spots me and then he comes close by and he again blesses me with lots of chocolates and he says, start doing open heart surgeries. So that's how I start slowly doing open heart surgeries. And regularly in the darshan line and all, he will come and ask me, what is the case today? How many cases you have done? What are you doing? And things like that. And it was like, I felt like he was charging me each and every day with his blessings. And then one more surgeon joined. So it so happened like one theater, he would be doing all little complex surgeries. And in the other theater, I would be doing 2 to 3 cases, simpler cases. And then one of our sister revealed to me that when the hospital was about to start, Bhagwan had revealed once in the veranda that there will be a lady cardiac surgeon and there will be a male cardiac surgeon who will be operating there in each theater. So this kind of looked to be true. And I was doing practically in one theater 2 to 3 cases, and because he was doing more complex cases, he would be doing around 2 cases. So we were doing around 5 cases a day, and very proudly Bhagawan would tell everybody, see my doctors, how much work they are doing and things like that. So anyway, apart from that, now this was hardly a year went by, and again the new cardiac surgeon who had come left. So again I was all alone. So this was the time when Professor Venugopal visited again the hospital, and he asked me to start doing bypass surgeries. Now, bypass surgeries in our field are considered a little more complex surgeries, which requires more training. They are more microscopic. They are very small vessels which need to undergo bypass of the heart. The vessels of the heart are 1 to 2 millimeters. So you need a special magnifying loops and all. So I very frankly told him, sir, I am not confident. I cannot do that. So he told me, I will pack you back to Bombay if you do not do it. So I, in my mind, said, you can do whatever you want, sir, but I will not do it. I think the Bhagawan must have got the message. So I was sent for 2 months. I was sent for a month's training to All India Institute, where I witnessed I was in Dr. Venugopal sir's operating theatre, and I witnessed this complex surgery. Then Bhagwan sent the word that tell her to spend another month with Dr. Iyer and do pediatric cardiac surgery. So I spent another month and I witnessed pediatric cardiac surgery. And when I returned back, I had not operated on a single patient in this 2 months. I had only witnessed. I was an observer. So I thought I have to make this very clear to Bhagwan, lest he think that I have to start operating on the patients. So when he took me for the interview, I said, Bhagwan, I have not done a single surgery in All India Institute. So can you believe what he says? He says that for you, seeing is enough. I knew what he's trying to drive at, that for you, seeing is enough because I'm the doer. Bhagwan is the doer for me. So this was a big revelation in a way. And then slowly but surely, you'll not believe, I started doing all kinds of cases. Now that was not to be. I had a deep desire for babies. So I wanted to do pediatric cardiac surgery. In fact, neonatal cardiac surgery, which is even like less than 1 month old kids. So I had applied for a fellowship program in Boston Children's Hospital and I had got it. So this was around year 1999. So I again went to, Swami was in Vrindavan. So I still remember distinctly the last bhajan was going on when I rushed there. Again, he spotted me from the stage. He came down and he said, what is it? What is it? Why are you here? So I said, Swami, I have to go to America for this. So he said, okay, I'll call you tomorrow. So when he called me for the interview, I said, Bhagawan, I have to go for this fellowship program. So very proudly, I remember some politician was sitting there and whoever was there. She said, Neelam B Desai is going to America. So I said, boss, this is it. Now I will be definitely going for this fellowship program. So I told Swami, I have to appear I have to clear USMLE exams, before that, Swami. There are 3 parts to it. So I have to study for all this and all. Oh, okay, do all that. So for my USMLE part 1, he gave me the blessings and I appeared for it. I cleared it. Now comes the beauty. The USMLE part 2. I have got the dates, I have shown to Bhagawan, and now he is not looking at me at all in the darshan line. Every time I'm coming for darshan, Swami is going on the opposite side. Now this happens on the last day. That day the exam was somewhere roughly around 11 o'clock. And those days Swami used to come early, around 6:30, So I thought even Swami comes at 6:37, I can still rush for my exams. That day also, Swami did not come to me. And I had decided I'm not going for exam unless I get Swami's blessings and things like that. So I did not go for the exam and I was heartbroken. I said, what is this now? Why is he behaving like this when he has told me I'm going for the fellowship program? So I'm very angry with Swami. So then my mother says, do you understand who he is? He's God. Don't you understand? There's a larger purpose why he's doing this to you and all that. So then I write a letter of apology, and immediately in the few days' time, Swami, it comes to my thing. When I sit with this letter, he accepts it. And then in a very short while, I understand the significance of me not being sent to US is 2001. The Whitefield Hospital comes up, and Dr. Shekhar Rao, who was the HOD then, he is transferred there. And once again, I'm all alone in the department. And if I had been to US, then there would be absolutely nobody here in Puttaparthi. So I think this was one of the main reasons why he did not want me to go, I feel. And you will not believe, within a short span of time, I started doing all the cases, which I think I would have gone there and learned. So practically in a few months to in a year, I was doing practically everything. So Bhagavan gave in his own way without sending me to US. So that's how the professional journey has been. He never made me feel like, that anything less. I very distinctly remember when I came to this place, in the initial first 3 years, when I joined in 93, 94, 95, you will not believe, Bhagavan had organized international symposias. And these were such grand international symposias. The cardiologists and the cardiac surgeons from all over the world had arrived to Prasanthi Nilayam. And my boss, who was my boss in Bombay, had also attended this conference. And I remember him telling me, Neelam, what are you doing in this place? This place, are you okay to come to this place? So professionally, you think you're going to be getting what you want. So I said, I told him, I still remember telling him, sir, the day I feel that I'm not going to grow professionally, I'll leave this place, I told him. So I still distinctly remember that Bhagavan never gave me an opportunity to feel that, professionally we are anything less. And I have been made to do all kinds of surgeries. And when the foreign visitors also, when they come, they are very amazed to see in my ICU the spectrum of cases which are being done. Like we are a 20-bedded ICU, CTVS ICU. At one end of this, there's a 5-month-old child. The other end is a 60-year-old or 70-year-old patient. All kinds of cases ranging from congenital heart diseases to valvular heart diseases to repairs to bypass cases, and you name it. And we have been doing all of this. And yes, barring transplants, we have been doing all kinds of cases. We have a lot of rare cases to our credit, which we have published in our journals, and we have been accredited also for that. So this is, then we have seen few things in the OPD, which I think the outside world has not seen, because we are catering to a vast majority of population who comes to us very late in life. So for the medical field, we can say we have seen what is called walking, talking left means. Now, left mean is a viral medical emergency where anybody who cats and finds that his left main coronary artery is very tight is rushed into the operation theatre. So we have seen these patients are walking into our OPD because they have had the CAT done few months ago or a year ago, and they're still walking and talking, and nobody has rushed them to the operation theatre. So we feel the whole epidemiology and the whole the spectrum, sometimes we feel will have to be rewritten. Then we find children where again our foreign teams, they say beyond 2 years of life, those who have high lung pressures, what we call pulmonary hypertension, they should not be operated upon. We have done cases who are 30-year-old and 50-year-old, and they are hale and hearty and doing very well. They've gone back to their, active work life, and they are doing absolutely fine. So these are the things which we find. So I would say on the professional front, Bhagavan has taken tremendous care to see that I have nothing to complain about. Now, having come to Bhagavan, I think the transformation starts at a different level, I feel. It's not only the profession for which I think I have been brought here. I feel the Bhagavan starts bringing about a change in another dimension, I would say, where you start realizing that there's much more to it than just the hospital and things like that. So the omniscience, the omnipresence and omnipotence of Bhagwan got revealed to me and my family very beautifully, where I would say, as regards the omnipotence, I would say my mother, she suffered from severe neck pain, and practically she was in such severe pain past 3 days that I was worried that I knew it was not related to heart disease, but she needed some attention. So once again Bhagwan was in Whitefield, and when we went there, so that time we had this beautiful tri-sessions. So at the end of it, of course, ladies were not allowed there. It was a prerogative for gents. So my brother and my dad had gone to attend the tri-session, and that's where Bhagwan spotted them and asked them, where has Neelam come? So then they said yes, and my mother is not well. So Swami called all of us very in his profound kindness. And that's the time I told Bhagwan that, Swami, I would like to take her to a neurologist. See how you get so carried away. I mean, the science takes you, you forget that you're in front of God who can cure your problem. Why you have to go to a neurologist? So Bhagwan said, kya problem hai? So I said, Swami, she's having severe pain. So he looked at her, and then he looked at me and he said, don't worry, it's not a heart problem. I said, yes, Swami. So then he just touches her at 3 different spots in the hand. And that severe pain which I had noticed just vanished there and there itself to never come back again. So this is his greatness. And then, to believe it or not, like my mother believed a lot in vibhuti and in things like that. So one fine day she develops a fracture in her left leg, left foot. So she ends up getting a plaster cast, which she's supposed to keep for 4 to 6 weeks. By the end of second week, she's fed up and she says, nothing doing. I'm removing this and I'm going to apply only Swami's vibhuti. And believe it or not, she gets herself cured by vibhuti alone, I think. Now to test her again, I think, Bhagwan sorted, she fractures her right foot. So now this time she is very, very adamant. She says, nothing doing. I'm only going to apply vibhuti. And that's how she manages herself. Until the end of her day, she was walking, running about with no issues. So this is his omnipotence, which slowly starts getting revealed. As if this is not enough, my mother would always have the habit of coming for afternoon darshan. So she would be rushing to have Bhagwan's afternoon darshan. Those were the times Bhagavan would come early, around 3:30 would come. So my mother would rush to have his darshan. So one fine day, she gets a severe chest pain when she is rushing for his darshan. And then she gets the premonition. And after the darshan is over, then, they had to, she would love to go for bhajans. So she's seated in the bhajan. Those days you had those rows, which were put so that you can go inside, depending upon the first row you get or second row. So she's seated there. That time she starts getting the message as if from Bhagavan. Open your purse, take the vibhuti out, eat it. And then he kind of gives her the instructions how many times in a day she should take. And one very clear-cut message which says, do not tell Neelam. You're not going to tell her. That day, that time when she had this problem, my dad had gone to Bombay. So she comes back, and then when my dad arrives back, she reveals to him. And then only after Bhagavan gives her the permission, reveals to me that she had suffered from this. So then Bhagavan also tells her very clearly that if you tell her, then she'll get worried and she'll not be able to concentrate on her work. So this is again a clear-cut example. You do his work, he's taking care of you and your family, and there's nothing to worry about. So like this way, so many small things, we started getting the thing that, what about his omnipresence? Once it was the Akhand Bhajan, I remember, and I was seated there, and then he comes, and opposite me is Jayama madam. He goes to her. Then he comes back to me and he says, Bhajan gaega? So I said, Swami, I can't sing, Swami. He says, Kyun? Theatre mein to gana gata hai. I said, huh? Then I remembered, I have this habit, once the main part of the surgery is over, I will start mumbling a line or two in my mind or maximum it will be heard to my assistant. It's a very, very, it's like I would call it a release phenomena or what, the stress release phenomena or what. I'll just start mumbling a line or two very, very softly. Nobody knows it. In fact, hardly anybody can hear it also. So I said, this is too much. So this is the kind of omnipresence more related to my patients. Again, I had done one case where it was a hole and a valve repair in a 5-year-old child. And I was not happy with the repair. So I undo everything. And I again redo the whole surgery. So it takes a long time. And then next day I had gone for darshan. So he comes and he says, Chinna Papa, took a long time, but at the end, everything went off very well. Now, who has gone and told him all these things? I mean, so he starts revealing to me that, you don't have to tell me, I'm present all the time. I know what's going on. Like, these are all small things which keep on bothering, which keep on revealing to us that, he's concerned and he's there all the time with us. Then what else do I tell you all? This is how the journey has been. Yes. In between, when we will feel that the latest advances in our field we should be doing and all, you will not believe, from nowhere this visiting team of surgeons will come off from US. We have been very lucky to get Dr. Ravalu Jivanandam and Dr. Voleti. They would visit us and they have taught us the latest techniques. And I can proudly say that ours was one of the first institute to do beating heart surgery, where the first 100 cases, they never went on pump. So these kind of things, so you are working in an institute which has all the latest gadgets, latest state-of-the-art equipments, nothing to worry about, the monitors, the machines, and the syringe pumps. These are all the things, which are required for carrying on the complex cardiac surgeries and all. When visiting surgeons come, they are amazed to see all these things, in our institute. Our ICU is so beautiful. It is so well equipped that there's nothing to complain about. So these are the kind of things which are... So a lot of people ask me, what about after physical departure of Bhagawan? Bhagawan has gone nowhere. According to me, he is there. He has made us more realize that he was not only limited to the physical form, he's very much with us, in us, around. In my interview, he would always tell, I'm with you, in you, around you, above you, below you and all. So this has become absolutely true now, because he is always guiding you and guarding you. Because whenever I open that thought for the day, I'll be saying, Swami, today's case is tough, kindly bless me. Immediately the thing will come, my blessings are with you. Or when I would have finished the case and I come and just open the thought for that, wow, you did a good job today. Very, very apt for the thing, Then if I'm leaving this place to go out of Puttaparthi, some other place, he'll say, you go to any place, I'll protect you. As if, he's just there guiding you and taking care of you and things like that. So I would only want to say that Bhagavan has given us so much, me, my family. My family thing also, my dad was absorbed into the hospital. So my brother, when he came, I was very skeptical, I told you, in the beginning, that he would not join this place. He wouldn't come here. So the first time he came, after 6 to 8 months after I joined here, he went around the place and he's going and telling my dad, can I wind up everything and come off here, So then Bhagavan had called us. So that time, my brother, he said, Swami, I would like to come here. So Swami said, yeah, you're most welcome. And then he gave him the option, you can go to higher learning or you can join the hospital. Then as my brother said, Swami, whatever you say, then Swami made him the executive engineer of the hospital. So like that. So not to leave behind my bhabhi, my brother's wife, she comes here and Bhagavan sends her to Anandpur for doing B.Ed education, and then he makes her join the primary school. So my whole family was put to work. So this regret always my mother had. My mother would say, "You all are working for Swami except me." So we would always tell her, "Because of you, we are all able to work. Why don't you understand?" But she would always have that regret. And of course, I think she was very close to Swami. Because of her, I think we are all here. So I think I would like to just end by saying that I have been very fortunate to have been chosen by Bhagawan to be his instrument in his medical mission. And I feel my life has got sanctified because of this, my arrival to Puttaparthi. I would like to end with, I always remember this saying. I may not know the exact words, but it is, the mark of ignorance is the belief in the injustice and tragedy. What the caterpillar calls the end of the world, the master calls it a butterfly. So, I always feel when I had to leave Bombay and come here, I would feel, what am I doing? Where am I going? Though, of course, I knew that Swami would take care. But, doing cardiac surgery in a rural place where the thing has not started yet, that fear was always there. But in a less than a year's time, I knew I was in the right place. I was under the protection of Bhagwan, and I knew everything was going to be fine. So it is, I had a colleague who would always say, in our field, we need a godfather and a godmother. So I never realized that a day would come that I would not only have a godfather and a godmother, but verily God himself who would be taking care of me. So this has been, I think, I've been very blessed. And I would just thank Bhagawan from the depth of my heart. I would like to continue to serve him. I had the habit of giving letter to Bhagawan in my darshan line on every 1st February because I wanted to say thank you to Swami. So it was the 4th year, I distinctly remember. So he came and he asked me, Amy, what is this? So I said, Swami, I have completed 4 years. So Bhagavan said, 40 years more. You are going to work for 40 years more. So I was overjoyed because this is what I want. In fact, in one of the interviews also, I had asked Bhagavan, will I ever work for you always? Because I want to work for you always. So he had been so kind that he took my hand and he put his hand and my hand was in his hand and he, with his other hand, he blessed me by patting it that, yes, you will work for me always. So I only hope and pray, Bhagavan, I continue to work for you always. There can be no greater joy for me and my family, but to be your instrument and continue to work in this divine hospital. This is a stupendous hospital. Nobody can understand the gravity and the magnitude of work going on here. Free is not the only thing. Free, I think there are people doing free, but completely free, doing it with a lot of love, universal, where there is no discrimination of caste, color, creed, trying to do it with love and compassion. I tell you, our patients, they come smilingly and they go smilingly. You have to just see them, to believe it. So this is all, it can only happen in Bhagwan's hospitals. Yeah.